Hello, welcome to my channel Medicine with Dr. Morin. If this is your first time visiting, my name is Dr. Keith Morin. Many of my elderly patients have asked me recently what their risk of severe COVID-19 is after full vaccination. Many countries are reporting the numbers of severe infections after full vaccination, but they fail to provide any additional data about what kinds of patients are the ones with these severe breakthroughs. As of October 24, 2021, this is the CDC's data from the USA in regards to this. As you can see from the slide, there have been 10,859 deaths in fully vaccinated people. Of those 10,857 deaths, it was felt that 2,299 were not due to COVID, meaning that they had no symptoms related to the virus, but had a positive test and died because of factors that were not related to COVID. So if you take away these 2,299 people from the 10,857, you are left with 8,558 people in the US who died of COVID-19 while being fully vaccinated. Now, this is a very small number compared to the number of fully vaccinated people in the US, which is currently 190 million. This speaks to the success of the vaccines, of course. If you look at hospitalizations, which would be an indicator of a significant COVID-19 illness, there are 30,270 in total, people who were hospitalized but did not die. Now, what older people want to know are the characteristics of the people that end up in the hospital or die after vaccination. Obviously, these are the people that we better need to protect. It would be helpful to know what kind of health problems, or as we say in medicine, comorbidities, that these people actually have. There is no information on the CDC site that I can find with respect to this. However, there is a recently published peer-reviewed study in The Lancet. This is the Lancet study, and the authors, I make note, had no disclosures. This was done using the Yale New Haven Health System. And the study authors, what they did was a systematic review of all the people who were admitted to hospital with a positive PCR test between March 23, 2021 and July 1st, 2021. For all of these people, they determined their vaccination status. In total, there were 969 patients who were admitted with a positive PCR. They did not state the total number of hospital admissions during this time, but everybody, when they were admitted, were tested with PCR. Now, this graph shows the breakdown of those 969 people. As expected, the vast majority were unvaccinated, and there were 797 of those people. This is something that we're currently seeing no matter what hospital or medical system or country, that the unvaccinated make up the majority of people hospitalized. Obviously, as more and more people get vaccinated, this will change. And what I mean by that is that if 100% of people are vaccinated, then of course 100% of hospital admissions are going to be for COVID-19 in vaccinated individuals. As you can see, 103 people had one dose of Pfizer or one dose of Moderna, and there were 15 people who had received both doses of Pfizer or Moderna or a single dose of J&J, but had not quite gotten out to 14 days after their second injection, so they weren't considered fully vaccinated. This group was called a completed course, meaning they had received their vaccinations but were not past the 14 days. The number of fully vaccinated people, which of course was defined as having your full complement of vaccines and then being out more than 14 days, was 54. Then what they did was to look more closely at these 54 people who were fully vaccinated and had a positive PCR test. Because they were testing every hospital patient who was admitted with PCR testing, it's not surprising that many of these people, of course, were asymptomatic or had very mild symptoms related to the virus. And they actually were being admitted to the hospital for other reasons. In other words, they're being admitted not for COVID-19. Here's the breakdown on the 54 people. As you can see, there were 14 people that had severe disease. Severe disease was defined as people with a low oxygen saturation of less than 94% on room air, or a respiratory rate of more than 30 breaths a minute, or lung infiltrates greater than 50%. They then looked more closely at these 14 people to see what their comorbidities or other health problems were. Now, of the 14 people, the median age was 80.5 years of age. 4 of the 14 people needed ICU care. 1 required mechanical ventilation, and that means a tube was placed down through the mouth into the trachea to deliver oxygen into the lungs. 3 people of the 14 died. These were the comorbidities that were present in these 14 people. 9 people were overweight or obese. 12 people had cardiovascular disease. 7 people had lung disease. 4 people had cancer. 7 with type 2 diabetes. And 4 people were on a medication that suppressed their immune system. This slide looks at these 14 people. Now, there's a lot on the slide, and it may be a little difficult to see if you're watching this on a small cell phone. But as you can see from the ages, these are all elderly people, many of them who are overweight or obese, and a normal BMI is 18.5 up to 25, to put it in perspective. 13 of the 14 people had the Pfizer vaccine, which was the most common vaccine in Connecticut at the time. Only 1 of the 14 received the Moderna vaccination. The total number of vaccines, to give you an idea of Connecticut, were 1.3 million for Pfizer, 1.04 million for Moderna, and 0.27 million for the J&J. Now, based on these small numbers, there's a much higher percentage of people getting a breakthrough infection after being vaccinated if you had Pfizer versus Moderna. This is deserving of further study. This may very well have to do with the fact that the Moderna vaccine actually contains more messenger RNA, 100 micrograms, compared to Pfizer, which is 30 micrograms of mRNA. In addition, Moderna vaccine is given 4 weeks apart instead of the 3 weeks with Pfizer, which is likely another benefit. In my most recent video, which was on vaccine efficacy as well as mix and matching, I presented data from 2 provinces in Canada, both of which found that the sweet spot for the time between the 2 vaccinations actually was 7 to 8 weeks. This is the data for Pfizer from British Columbia, if you didn't watch my last video. There was no additional benefit if you look at the graph, extending this out to 16 weeks between the 2 shots, but clearly 3 to 4 weeks was not as good as 7 to 8 weeks. Here's the data from the other province, Quebec, and you see the same thing happening here for Pfizer and Moderna. In Canada, they did use the AstraZeneca vaccine, and you can see that it took 16 weeks, which is 4 months between shots, actually to get the vaccine efficacy up at preventing infections to Pfizer and Moderna. Now, getting back to the 14 people in the study that I'm talking about, the last 5 columns of the slide looks at comorbidities. And you can see there that patients had multiple comorbidities. There actually was only 1 patient who did not have any of the 5 comorbidities, and in fact was of ideal weight as well. They didn't make any specific comment about this 76-year-old man, but I do wonder whether this person had a comorbidity either not classified or diagnosed at the time. I do hope that there's further studies published on who gets severe breakthrough infections. And this is important because it will allow us to decide who would benefit from a 3rd vaccination. In other words, who needs a little more protection. This is an important thing to research so that we know the benefits of that 3rd injection, and we can balance this also with the risk of getting a 3rd one. It's also important in terms of vaccine equity, as 36% of rich countries are now giving 3rd vaccinations, while 97% of people in low-income countries don't even have their 1st shot. So in summary, the data in this study is exactly what you would expect. The people who get serious breakthrough infections are elderly and have multiple comorbidities. Therefore, it's important to be as healthy as you can be. And if you do have comorbidities, try to reverse those if possible, or at least get these under good medical control. Thank you for joining me today on Medicine with Dr. Morin. I'm Dr. Keith Morin. Get healthy and stay healthy.